Hi everyone, and welcome back to another video. Today we're going to be taking a look at the difference between narcissistic personality disorder and the pseudo-narcissistic schizoid. The pseudo-narcissistic schizoid was a subtype of schizoid personality disorder or schizoid adaptations that was highlighted by J.F. Masterson and Ralph Klein in their book that was titled Disorders of the Self, New Therapeutic Horizons, the Masterson Approach. He highlighted actually 5 different types of schizoid, which you can see here. Today, we're just going to be focusing on the pseudo-narcissistic schizoid, and we'll be looking at why sometimes in diagnosis, the pseudo-narcissistic schizoid will be diagnosed as having narcissistic personality disorder, when in fact they are 2 different distinct conditions. In previous videos, I talked about the fact that people with schizoid dynamics can present in very different ways, depending on the behaviors and attitudes that they develop. Fundamentally, they all have underlying emotional detachment, and the characteristics of schizoid dynamics, but can look very different from one another on the surface. First of all, we'll have a look at narcissistic traits and what they are. And I think it's important to make the fact that people with narcissistic traits are not always pathological. Everyone has some degree of narcissism in them, and in fact, narcissism has evolutionarily been an important part of the human survival mechanism. And when it is healthy, it can contribute to self-confidence, help a person to assert themselves, to have ambition, and that people with a healthy level of narcissism can have the feeling of valuing oneself and wanting to make accomplishments, while at the same time managing to maintain empathy and being able to adapt healthily within relationships. So yeah, it's part of a spectrum. As I mentioned, people with a healthy amount of narcissistic traits can be confident, have self-worth, and ambition without harming others. With the unhealthy manifestation of narcissistic traits, it can lead to lack of empathy, entitlement, and a need for admiration. So it becomes problematic when people start to dismiss other people's feelings, seek admiration at the expense of relationships, are reactively defensive to criticism, or engage in exploitative or manipulative behaviors. So some level of narcissism is necessary for self-esteem and success, but excessive narcissism can damage relationships and well-being. When we look at the Guntrip criteria of schizoid personality, and we look at the 9 core traits of schizoid personality, we can see that self-sufficiency, sense of superiority, and narcissism all feature as traits. So one might ask, is there a need to differentiate between what might be thought of as a standard schizoid personality and one that displays pseudo-narcissistic tendencies? The traits that schizoids display vary in the strength or the pervasiveness, and so we could think of the pseudo-narcissistic schizoid as having a higher degree of narcissistic traits than other schizoids. And so with the pseudo-narcissistic schizoid, the narcissistic traits are going to show more strongly than in certain other subtypes. I've constructed a chart so that we can look at the different aspects of narcissistic personality disorder and compare it directly with the pseudo-narcissistic schizoid, so we can get an idea of how the two actually fundamentally differ. After this, we'll look at what aspects may look the same on the surface, so we can see why these two types may be confused with one another. Starting with use of narcissistic traits. In narcissistic personality disorder, I'll call it NPD to make it more simple. Their traits are used to reinforce grandiosity and to maintain superiority. Whereas with the pseudo-narcissistic schizoid, their traits are used to protect against emotional closeness and not for seeking validation from other people. Core motivation. People with NPD seek admiration and validation, and this is driven by their sense of grandiosity and to maintain grandiosity in the eyes of others and themselves. The pseudo-narcissistic schizoid maintains emotional distance through avoiding vulnerability and self-sufficiency. Primary defense mechanisms. With NPD, it's denial, projection, and evaluation, whereas with the pseudo-narcissistic schizoid, it's withdrawal, intellectualization, and fantasy. So this is fundamentally the same as with all other schizoids. Sense of self. With NPD, they have a grandiose sense of self and an inflated sense of importance, whereas with the pseudonarcissistic schizoid, they lack a stable integrated sense of self and they are internally withdrawn. Interpersonal relationships. With NPD, they seek relationship for validation and engage with others to get admiration and control. The pseudo-narcissistic schizoid, on the other hand, sees other people as being intrusive and avoids intimacy due to fear of being controlled or emotionally engulfed. Underlying fear. People with NPD fear inadequacy or being unimportant, especially in the eyes of others. The pseudo-narcissistic schizoid has a fear of engulfment or loss of autonomy. Emotional responses. Narcissistic personality disorder tends to cause people to be highly reactive and defensive and to display anger or rage when they're challenged. Whereas with the pseudo-narcissistic schizoid, they suppress emotions and rely on self-containment. And finally, with the response to criticism, people with NPD can be deeply wounded by criticism and they can react with rage or withdrawal. Whereas with the pseudo-narcissistic schizoid, they tend to feel invisible or unseen, and they may react with withdrawal or existential panic. Like the existential panic comes from feeling that they don't exist, but they're generally indifferent to validation. So that's quite different from the narcissistic personality disorder. Now we look at the manifestations that can make them seem similar. And these things are emotional detachment, superiority complex, preference for control, limited social engagement, and a sense of specialness. With emotional detachment, they can both appear cold, distant, or indifferent to others' feelings. Schizoids tend to use intellectual or emotional superiority, usually intellectual though, to maintain distance, while narcissists seek admiration. Both may seem controlling, but schizoids do so to maintain autonomy, whereas narcissists do it to dominate. Both avoid deep relationships, though schizoids do so out of discomfort, while narcissists do so to maintain status. With sense of specialness, schizoids use this to justify their isolation, whilst narcissists use it to demand recognition. So what we see here in the general trend is that with schizoid individuals, they tend to be less reliant on other people's perceptions of them, whereas with the narcissistic personality disorder, they're quite dependent on other people's perceptions of them in order to maintain their grandiosity. I kind of think of it that with the narcissist, they can get high on other people's supply, whereas with the schizoid pseudonarcissist, they can get high on their own supply. So the difference comes from the need or not need for external validation. So Masterson outlined 3 main core sensitivities that everybody has, but in some situations, like if there are early attachment disruptions, that people can develop rigid defense adaptations, which means they can get stuck in rigid patterns, and this can lead to maladaptive behaviors or dysfunction. This will become clearer. The 3 types of sensitivity are separation sensitivity, esteem sensitivity, and safety sensitivity. Fundamentally, schizoids have safety sensitivity above and beyond anything else. Theoretically, a person can have a mix of all of the 3 sensitivities. However, if one is fundamentally a lot more prominent and leads to certain ingrained patterns and behaviors, then that core sensitivity is going to shape a person's development. This would explain why someone with schizoid traits could fundamentally have a core sensitivity for safety, but at the same time display narcissistic traits. Masterson outlined how core sensitivities exist on a spectrum and they're not inherently pathological. Personality disorders emerge only when these sensitivities become rigid and cause significant dysfunction. Individuals can exhibit traits from multiple sensitivities with overlapping patterns influencing emotional and relational dynamics. So what's going to be important if someone is displaying narcissistic traits is what is their core sensitivity? Is it separation, esteem, or safety? Because on the surface, the behaviors can merge to some degree and make it difficult to differentiate between the different adaptations. We have a case study about someone called Alice. She's a 32-year-old marketing strategist. She sought therapy at the insistence of her employer after multiple conflicts with colleagues and superiors. At first glance, Alice's grandiose self-perception, entitlement, and lack of empathy suggested narcissistic personality disorder. She dismissed feedback from others, believing people failed to recognize her unique insight and talent. In the initial sessions, Alice expressed superiority over others, particularly in her professional life. She dismissed therapy as useless, but continued attending due to external pressure. Had little emotional reactivity even when discussing personal failures or rejection, seemed indifferent to praise or criticism, which contradicted the classic NPD hypersensitivity, claimed she had no real need for close relationships, though she acknowledged a sense of detachment from life. Her external persona fit the arrogant, self-important characteristics of overt narcissism, but something was missing. There was no real investment in maintaining a grandiose image. Unlike NPD patients, she did not seek admiration or feel devastated when ignored. She simply withdrew further. Through deeper investigation, Alice's narcissistic traits revealed themselves as a protective shell rather than her core personality structure. So what we see here at a glance is that a lot of the issues she experiencing was internal, though it was having a knock-on effect on her career and on her relationship with colleagues. She wasn't overtly going out to cause conflicts, but it was more of an attitudinal conflict than her initiating or starting problems. We'll go on to have another look at the key indicators of Alice's pseudo-narcissism. I'll explain in more detail so you can understand. Sense of superiority as a defense. Unlike NPD, where grandiosity fuels validation seeking, Alice's self-importance was a tool for isolation. She used it to justify her emotional withdrawal rather than to seek external approval. Indifference to admiration. When confronted about her need for validation, Alice admitted she didn't care if others admired her. Unlike NPD, where admiration is necessary for self-worth, Alice simply wanted to be left alone. No true emotional highs or lows. While narcissists crave attention and react strongly to criticism, Alice was emotionally flat. She neither sought praise nor lashed out when ignored. She simply became more distant. Superficial social engagement. Alice interacted with others to maintain functionality, work daily life, but avoided deep emotional intimacy. She had a history of brief transactional relationships, ending them not out of drama, but out of a quiet disinterest. Fear of intrusion rather than fear of inferiority. While NPD patients fear being exposed as inadequate, Alice's real fear was being emotionally entangled. She kept people at a distance, not because she thought they were beneath her, but because she feared being consumed by their needs. When probed about moments of distress, Alice described feeling like she did not exist when others failed to acknowledge her. She wasn't enraged like a narcissist would be, rather she felt eerily detached or even dissociated. What we can see about the pseudo-narcissism is that they can use their superiority, and this is often linked to intellectually being above people or being out of the realms of being able to be understood by people, being too unique to interact with people, being on some way on a different level from everyone else, that they use this superiority to create distance between self and others and not as a means to seek admiration. In this situation, there was a case where Alice was treating people like they were beneath her, and the treating people like they were beneath her wasn't genuinely coming from a place where she thought she had higher status than them, but it was more a distancing tactic. So that is the difference between the pseudo-narcissism and the NPD, that the pseudonarcissistic isn't seeking external validation to maintain grandiosity, but rather using grandiosity to create distance between self and other. So breaking the facade and getting to the bottom of what's really happening underneath the behaviors, what is the core sensitivity or the core issue that was going on. As therapy progressed, Alice began to acknowledge her underlying schizoid defenses. She intellectualized emotions instead of experiencing them. Her superiority was a mechanism to remain detached, not a true sign of narcissistic grandiosity. She longed for a connection but felt threatened by it, explaining her paradoxical desire to be recognized yet remain unseen. Sometimes recognition is used, like I've done a video about schizoid exhibitionism where schizoid individuals could showcase their talents or abilities in a way to have a form of connection with other people without having any intimacy with that person or those people. So in the case of intellectual prowess or her work, through getting the recognition for that, it was a remote way of maintaining a connection with the world, although not wanting to be close to other people. It's quite a complex thing. That is why it's paradoxical that a person wants to be recognized yet unseen. So recognized for their work, but unseen as on an interpersonal level or as a person or individual. And that's where the paradox really does come in. 5 key takeaways about pseudo-narcissistic schizoids and misdiagnosis. 1. Pseudo-narcissistic schizoids are often misdiagnosed as having NPD. We talked about that. Their narcissism is a defense against intimacy, not a core personality trait. They handle criticism and social conflict differently from narcissists. They struggle with a core sense of disconnection, not fragile self-worth. And we can throw in the core sensitivity of safety versus the narcissistic core sensitivity of esteem. Proper diagnosis requires looking beyond the surface traits. Final thought. Pseudo-narcissistic schizoids are not grandiose attention seekers, but emotionally withdrawn individuals using superiority as a shield. Recognizing this distinction is essential for accurate diagnosis and effective therapy. That was Masterson's Pseudo-Narcissistic Schizoid. Summed up pretty briefly. There is more depth that could be gone into it. However, that is like a general overview. As you can see, he also talks about a pseudo-borderline schizoid, avoidant schizoid, a secret schizoid, and a classic schizoid. I will be covering the pseudo-borderline schizoid in next video so that you could see why some schizoids may be misdiagnosed as having borderline personality disorder when you look beneath the surface, there's actually a schizoid core and schizoid dynamics taking place. I hope the video was clear, and if you've got any thoughts about this, you can leave them in the comments, and thanks for watching.